Hello, it's Jennifer with BrainLinks, and we're going to talk today a little bit about kind of an overview of what is TBI and what it is like for children when they sustain a TBI or concussion. So here's a definition of TBI. A traumatic brain injury is caused by a bump, blow, or jolt to the head or body, or a penetrating head injury that disrupts the normal function of the brain. So when you think about TBI, you may be thinking about a much more serious injury, but it also can include concussion. And something to keep in mind is that most people, when they have a concussion, do not lose consciousness. So even though losing consciousness can help you know that someone has had a concussion, it's only going to happen to about 1 out of 10 people. And another thing that you always want to keep in mind is this part here about a blow or jolt to the head or body. So a person does not have to have a direct hit to their head. Their head doesn't have to come into contact with anything to experience a traumatic brain injury, including concussion. An example of that might be something like a whiplash type of injury. So if a person's in a car and they're maybe hit from behind and they're jerked really hard, that's a jolt to their body. And that causes their brain to move back and forth inside the skull as they're reacting to that impact, and that causes the injury. In Tennessee, there are 68 people each day who experience a traumatic brain injury. So that number is approximate, but it's usually in that neighborhood of, if you break it down into an average, 68 people in Tennessee having a brain injury every single day. Now, when we look at this chart, I want you to look at this information up here. We're looking at, previously we were talking about 68 Tennesseans of any age experience a TBI, and this chart focuses on those who are student age, 0 to 22. So those are 0 to 22 is served through our K through 12 schools in Tennessee. So what's important to notice on here is the green represents the hospitalizations, and the blue represents those who were treated and released in the emergency department. So if you look at something here, you'll see that the greater number of hospitalizations occurred with injuries as a result of motor vehicle accidents, and then the number 2 cause was falls. And sadly, some of the other higher causes of hospitalization are assault and child abuse. And struck by and against is the category that includes sports-related concussions and sports-related TBIs. The emergency departments mainly consist of falls, and then the struck by and against category, with motor vehicle in this age range, 0 to 22 being third. But what's really important to note here is that our Tennessee data really mirrors the national data, and that if we take one thing away from this, think of it that most people, even going to the hospital, treated and released or hospitalized, they're going home, and they're going back to school, and for adults, probably going back to work. Some older children may be going back to work, and they're doing that with symptoms. So they're going to need help. TBI can happen in so many different ways. Maybe you're first thinking about car accidents and sports-related injuries, but it can also happen for most people more than you think. And in some states, falls are number 1 as far as the cause of TBI. So people can fall and have a brain injury. The struck by and against category in Tennessee, as I explained a minute ago, includes sports-related injuries, motor vehicle traffic, and pedestrian-related TBI is also part of this. Assault and self-harm related to TBI. There's also a category for unknown causes, and some category called other that lots of other types of injuries fall into. No one expects to have a TBI. It's the type of injury that just happens, and then your whole life becomes immediately dealing with the aftermath of this injury. What's really important is getting great education about it and getting help immediately, and not letting someone go unidentified and missing out on some help that they get. Some other ways that people can be injured that you might not have thought of. We put together a webinar for Department of Children's Services, Tennessee, as part of a series about traumatic brain injury and concussion, and wanted to make sure that we're including other ways that people get injured, like being hit in the back of the head over and over, being bullied, being pushed, being thrown against a wall, falling off a bed, especially for a baby or a toddler, an accident from being pushed really hard, strangulation, and all of these things, they happen every day. So even though they are a little difficult to think about, this is how a lot of people sustain a traumatic brain injury. With DCS, one of the things that can be important to think about is not knowing that someone had the injury in the first place. Maybe knowing that something's a little bit different about that person, or knowing something's wrong, but not really understanding what happened to them. So asking when you're working with someone or you care for someone who you think might be experiencing some unusual symptoms, asking them, not looking at it in a way of what's wrong with that person or what's wrong with you, but what happened to you, what happened that might have caused these changes that I'm seeing. Thinking that the problem will just go away is a possibility in some situations where families may just be really in denial about the injury. Maybe they're dealing with some other problems that might just seem more urgent. It might be hard to relate to something being more urgent than a brain injury, but we really do live in a society where people tend to downplay concussion. There might be problems with being afraid of losing custody or child abuse charges, not knowing where to go for treatment, not realizing that there are changes and advancements in concussion treatment, not being able to afford treatment, or think that a person might not be able to access treatment because of the cost. All of these are issues that can affect anyone, but might be especially important for people served by DCS to take into consideration. Well, when we're talking about signs of pain, for the very young, even though this information applies to all ages and our program serves people of all ages, you do want to pay a little special attention to the very young, because especially with children who are not able to talk and explain their symptoms, might be a little harder to see those important signs to let you know that they're in pain and need help. So something you can look for is excessive crying, increased muscle tightness, facial changes where they seem to be really tense or stressed, changes in breathing. These are important to note in the younger children, but the same can apply for people who communicate without using words. So that might be adults with a developmental disability or someone else who is not able to speak and tell you what's going on. These pain indicators can be really important to understand and be able to get someone help immediately. This is danger signs to look for, especially when someone has had a TBI or concussion. When one pupil is larger than the other, being drowsy, it's hard to wake them up, blurred speech, a headache that gets worse and doesn't go away, repeated vomiting or nausea, seizures, definitely all indicators to get medical attention immediately. Loss of consciousness, definitely something that would be very serious, and you need to get somebody help right away. Unusual behavior, increased confusion, all of these are clear signs that there's something very serious going on and that person's in danger. So we're going to go over just a couple of slides here on the myths. You don't have to hit your head to have an injury. You don't have to have a loss of consciousness to have an injury, even a serious one. A clear CT scan does not mean that you have not had a concussion. So maybe you're used to hearing that called a CAT scan. But a scan is not going to necessarily show concussion. Concussion is much more of a functional injury that shows changes in your behavior and your abilities and what your brain can do, more than it's going to show physically up in a scan. And having only a concussion, it doesn't mean that there aren't going to be long-term consequences. You can have a concussion and still have symptoms that last for months or even beyond a year. So it would be really good if you can help educate others and really help people understand concussion in a different way and not say the words, it's just a concussion, because a concussion is an injury to your brain, and all injuries to your brain are serious. Just because you can't see the injury doesn't mean something's not wrong. So we can't see inside people's heads, and you may not even have a bruise on the outside of your head with concussion. It's like I said about the functional changes. It's going to be the way the person changes in what they can do, and how they behave and how they feel that's going to be more apparent. So you may not see anything at all. There are now active treatments for concussion, so I really recommend that you check out the 6 types of concussion video that we have here on our YouTube channel. It will tell you a lot more about that, but you don't have to suffer with concussion and wait for it to get better. A few days of rest after seeing a medical professional who's experienced in concussion is great, that you can actually get back into your life and gradually get back to normal. And just because someone might have good days or bad days, or be able to do something really well one day and then go back to the same thing the next day, maybe work or school, and have trouble with that, it does not mean someone's faking it. Brain injury can be inconsistent, and the recovery can be inconsistent. So that's an important thing to understand, that most people aren't going to ever consider trying to fake an injury or fake help that they need after concussion. They could just really use your understanding and support. Thank you so much for viewing this video, and please check out our other videos in the series.